I'm Jessica, and I work at Spruce Health. We're a communications platform. I know a lot of the people on this call are probably our customers. And speaking of, I wanted to talk today about how you DPC providers, how you won when COVID hit. And I'm just going to talk a little bit about what we saw in the numbers. And for those that don't know, Spruce is a communications platform. A lot of DPC providers use Spruce for their phone system, texting, telemedicine, and fax. So I'm going to bring out some of those numbers to show you. What happened when COVID hit? In March, which happened to be my birthday month, right after my birthday, I think it was March 17th or 18th, the world really turned upside down. I think we all saw, as providers, as patients, we all had so many questions. Should we close our office? Should I move everybody to work from home? Are my kids out in school? What's going on? Patients, do I have COVID? What are the symptoms? Can I get it from my groceries? Like, just so many questions. And then people started to cancel appointments, especially your routine appointments. And they didn't know what else to do. They just froze. Then you had to decide, should we cancel appointments? Should we not cancel appointments? Should we move them to video? There was just literally so many questions that everybody had. And the patients wanted answers, and you only had one phone call, one phone that you could help them. So this is hard, and it was really hard to help everybody really quickly. And we also didn't have the answers. So that makes it even harder. But direct primary care, you guys were ready because you're used to this direct access. You were used to being able to educate your patients when you needed to, whether it was sending a bulk message to all your patients in Spruce, sending an email, updating your website, whatever it was, saving a template message and sending it out to patients when they had questions. You guys were ready to do that. The other thing, you were used to using your cell phones. You had a flexible phone system built into place. That's what you're all come to me for every day. Like, I want to, give direct access, but I don't want to give my cell phone out. So you were ready to move from your desk phones to your mobile phones. Spruce obviously helps with that, but everybody was already giving that type of access. So your patients knew how to get a hold of you no matter where you were. The other thing that we pride ourselves off in DPC is the ability to see people whenever they need us. So if they just want to text you and you want to help that way, you can. The other thing is video calling. Huge, huge way we see our patients in direct primary care. We had thousands of people reaching out to us to set up video calling. You were already set up for video calling. The transition was seamless. It just went from, oh, you don't have to come in. We can just do the video call. Just use your Spruce app. It was that easy. It was a business that was built for Care Anywhere. You were already set up that way. Everybody else was not. It wasn't as easy of a transition. And then on top of that, your staff may be at home, you're at home. How do you communicate to each other? And how do you communicate about patient care? You are also set up for that. Whether it's in your EHR or within Spruce, you're able to pass off messages and all that information seamlessly. All right, now the good stuff. So Spruce, we do communications and we have the data behind it. This is not actual raw data. This is a ratio. And so what you're looking at is January of this year, the use of our different communication channels was, everything was about the same. And then we divided it by our different channels. So the different channels that we offer here are secure messaging, where a patient has the app, non-VoIP communication. So that's through your cell phone. And then SMS, which is phone-to-phone text messages, and then VoIP calling. So you can see right around March when COVID hit, you can see that the VoIP desk phones took a dramatic drop because no one was in the office or people had stopped working in the office as much. So we had a dramatic drop in VoIP, which is desk phones, calls, and then an increase, obviously, in patients reaching out to secure message, to SMS or mobile use. So you can see that, and it continued to be used a lot more than the desk phones. And then we're seeing an increase, and we are seeing that as people are opening up their offices more, et cetera. All right, another thing we came out with when COVID hit was Spruce has asynchronous question set telemedicine. And so we came out with a COVID screener. We also have a ton of other screeners and different exams that you can do in Spruce. A very popular one is our acne exam. So what we did was we compared the COVID screener to acne, and was. So you can see here, this is the relative COVID Spruce visit volume versus acne. So acne did, this is April 1st, if you can't see it. Acne did go up a little bit because we are seeing more remote care, whether it's acne or a COVID screener. But you can see how much higher the COVID screening was. And we had this big increase here, and then it's flattened out a little bit since then, but it's still, the volume's still very high as well. All right, and this is no surprise, but we had to show this data. Around March, you can see this is our video calling through Spruce, and this is a ratio of relative to where it was before. And you can see this just skyrocketed, and then it's stayed pretty flat, but it's actually increased a little bit more. And I think it's just more people are getting used to it and replacing all the video, all their visits with video calling. Oh, and also Spruce has other customers that aren't direct primary care, and this is just direct primary care. And I also wanted to just pull out these numbers, which are direct primary care, and you can see how much compared to all other customers, you really utilize the video calling, secure messaging, and the SMS text. It was a big increase compared to the others because you already had it in place. You're already used to using it. The other groups we really found it wasn't in their workflows. They weren't used to how do you book that? What do you do? How do I educate the patient? Are they okay with that? Do I get paid? There was a lot of questions. So it was a little harder for them to increase that use as much as our direct primary care providers. All right, that is it for my presentation. So wanted to take some questions here and also just give more information about Spruce. If you need anything, please feel free to reach out to us. We're also doing a promo for any new customers, 50% off your first 3 months. And then also, if you want to see how Spruce texting works, feel free to text hi to this number, and you'll see how our advanced workflows work and automation autoresponders. So,
all right. So we do have a question about from Vanessa Tartaglia Keen. She's wondering, she's in pre-enrollment with her DPC and doesn't open until November, but she wants to know how to do bulk messaging with Spruce. Is that possible?
Yeah, it is. So there's a couple ways you can do it. If you're using Hint, what's going to happen is all your patients will be, even if they're in pre-enrollment, will be uploaded automatically into Spruce. So you can select all your patients, and you can even select the ones that chose a certain membership or are active or pending, whatever you want, because they'll all be labeled in Spruce. And so you go onto the computer version of Spruce, and you can click on a tag for your patients, or you just can select all in the upper right corner and then hit the actions button and then send them all a message. And you can insert a PDF, a video, which I love when people send out videos in the bulk messages. It's really great and personal. And then you can send it to them via text.
Great. There's another question about integration. So you guys obviously integrate with Hint, which basically makes it really easy for patients to enroll in Hint and then show up in Spruce. Mm-hmm. But do you also integrate with Athena EMR?
We don't have an integration with Athena right now. We have an integration with Elation. And so just like with Hint, it will populate a new patient chart in Elation. It will populate in Spruce, and then in Spruce, any communication can be synced to the patient chart in Elation. But if you don't use Elation, you can copy and paste anything to any other system, EHR or similar.
So I have a few questions about just the data that you showed us.
Sure.
I'm curious, Jessica, did you hear any interesting stories of people who are now switching to like more virtual care that were doing things that were really creative, that were kind of unexpected when COVID started?
So I think, I think people have been surprised how well the video and texting has been working. And I think the most surprising thing is there's certain populations that they thought wouldn't like video, whether technology challenged or whatnot. And I think that's been interesting to see that now more people are like, why am I even coming into the office? I don't want to drive across town, especially as you get older. It's harder to drive. And why would I want to drive when I can just do it over video? And it's so easy. And I think the most remarkable thing for me, to be honest, has been reading the reviews and people saying these remarkable things like, like, why am I driving across town? I could just, connect on my computer. It's so much easier. So
great. Are you offered in Indiana? That should be a quick question.
We are offered all of the United States. You can go to we're actually available in Canada as well. And you can just go to your app store and download Spruce Care Messenger or sign up at sprucehealth.com.
Another integration question, if you're integrated with Acute Health.
We're not integrated with Acute. We're only integrated with Elation at this time. However, if you use Hint, it will pull all your patient data in, and then you can simply copy and paste into your EHR. And for we are a texting and phone app. So what we've actually gotten feedback from our DPC community was not to have everything automatically sync into the chart because it was too much. So usually you just sync the actual encounters you want to go into the chart or the voicemail or whatnot.
What updates are coming?
Oh yeah, who has that? No. Well, we have some updates just to make everything smoother and easier. I guess the thing, we're going to boost up the contacts or your profile for your patients a little bit. That's the only thing I'm going to reveal. But look for stuff to come soon. We're really excited to share some stuff in the future with you. And whoever asked that, I expected an email from you.
I definitely encourage all of you guys to head over to the Spruce booth, especially if you don't have Spruce and you have some questions, or hit up support. I'm sure they could definitely help you to figure out how to add a patient, add a picture, add a send a bulk email, whatever it is you want to do with Spruce. So with that, just invite you guys to go along to the next session.